Hi, I'm going to be talking to you guys about seizures today. Now, if you could all do me a favor and stand up for a second. I know just a second. If you could all do 10 jumping jacks.
This is me.
I know, I thought about that last
Thank you.
You're welcome. Now, Lori, how do you feel, like physically?
A little short of breath and my heart's beating fast.
Okay. These feelings are typical. Now imagine that feeling of tiredness or your heart beating fast comes on right away when you're in class or talking with your friends. That's what the aura before a psychogenic nonepileptic seizure feels like for you. Other people have described it in many different ways. Nope, that's the power off button. There we go. Where's the laser pointer?
It's the middle big button.
Okay. This is an art I found of somebody who drew what it's like to be in a seizure, because in psychogenic non-epileptic seizures, you are aware for the most part of what is happening around you. Another person said that their head and body feel tingly, and they get this daydreaming feeling like they're not there before a seizure happens. All of these things are very offsetting, but the aura is also good because it, lets you know that you're about to have a seizure. Hi, I'm Elias Moore, and my thesis question is, what are the most promising treatment options for psychogenic non-epileptic seizures with the goal of minimizing or eliminating symptoms? To answer this, we must define a couple terms. First, what are psychogenic non-epileptic seizures? Now, I'm aware that that's a mouthful, so for the purposes of this TED Talk, I'm just going to be referring to it as PNES. PNES can look and feel like epileptic seizures, but they are not a result of abnormal brain electricity in the brain. That didn't make sense. Instead, they are basically, in simple terms, a messed up fight or flight response. Your body perceives a threat, and instead of your brain going into fight or flight like it normally would, it goes into freeze, and then one starts convulsing. Now, the other thing we need to talk about is what treatment is. Most people think of medicine or therapy when they think of treatment, but for this TED Talk, I am focusing specifically on non-pharmaceutical treatment options, so primarily therapies. This is because there are no medicinal treatments for PNES. Treatment has been around for a while, but treatment for PNES can be linked back to around 360 BC with the introduction of the term hysteria. Hysteria originally referred to symptoms said to be caused by the womb. Specifically, the womb moving from its anatomical position in the abdomen. Where the womb went is up to interpretation. Being as it's called the wandering room, I assume it just went on a walk. But it took a while, like centuries, for these male researchers to realize that maybe that's not possible, and maybe the men having seizures is also proof of that. So then they turned to the brain. Now that we've finally settled on the brain being the place of origin for this disorder, there are a few treatment options more successful than the first recommended, which was intercourse. Because, of course, if women are the only ones having these, the solution is sex. Eye movement desensitization and reprocessing is the best treatment method for comorbid PNES and PTSD. That is because it focuses on the etiology of the disorder. Now, the etiology, if you don't know, is like the roots of a tree. Things that cause the disorder. The original cause or the trigger of the thing. For PNES, that is typically trauma or severe amounts of stress. EMDR focuses on these roots and targets them because if we make the trigger no longer a trigger, then the seizures will die out, like uprooting a tree. But in the rare cases where there are no discernible roots, EMDR is no longer effective, which is where cognitive behavioral therapy, or CBT, comes in. CBT focuses on current thought patterns, and it is better than EMDR because it eliminates time wasted on possible triggers and instead focuses on active triggers affecting the patient. Now, I've gone through CBT. I started CBT roughly a year ago, and with Yale, and I graduated like December, end of the year. CBT can look a bunch of different ways, but the main part of CBT is reprocessing thoughts, feelings, and behaviors. It's targeting, if you're thinking in this negative way, then you need to change your thoughts, which will then change your feelings, which will then change your behaviors, eliminating the seizures. CBT, when I first started, they gave me this course that I will admit I was not thrilled to take, so I did not give it my all. But it was basically an online class like Keystone, where you go through and you learn a bunch of stuff that isn't relevant, and then boom, your seizures are gone, but they weren't. Basically, they would go through, for me, they taught me what depression is, which is fun because I already knew that. And then they taught me what anxiety is, and they taught me all of these different triggers. They didn't mention trauma at all, even though that is one of the main causes of PNS, which I find interesting. But that, safe to say, was not helpful. If anything, my seizures got worse during that time. Now, that might just be due to natural forces that are not the program. But then I got placed into the second testing zone. And this was more hands-on. This was, I actually met with somebody. I met with them online every Tuesday, I believe it was, and I also didn't find this, the active meetings very helpful, but it was basically like a therapy session, because one thing that I forgot to mention, during this whole process, I was not allowed to see a therapist. I was not allowed to see a therapist because it would intervene with they thought it would intervene with the science behind their research, and I was their guinea pig. So I would meet with this person, and they ask me how I feel, I tell them how I feel, and then we develop these strategies. So if I felt the aura, I would start doing these silly little exercises that I ranted to Erin multiple times about how much they suck, where I would basically do this, but with my arms and legs, while sitting on the ground and humming and moving my head around and naming objects. It was a lot to do at once, but the idea was to distract my body. If I'm going like this, I can't lock up. It's hard for me to lock like this and then have a seizure. I still have them, but I would practice these exercises. I had alarms set every 2 hours, every single day, that I would go and I would do these exercises, even if I didn't feel the aura, just so I could integrate it into my head. Then, when I graduated, they said to continue doing these exercises every 2 hours for a few months, and I did for maybe a week. But my seizures are pretty much gone now, with the exception of yesterday. Yesterday didn't, for some reason I had something, but CBT is also effective for others. Because it is so personalized, according to Cleveland Clinic, with a study of almost 400,000 people, they showed that people who did CBT and a 12-week treatment that is CBT, 47% of them were completely seizure-free by the end of it. And of the people that were not seizure-free, 82% of them experienced more than 50% reduction in your seizure frequency and intensity. Now, the biggest part of this is, what can you do? To be honest, not much, actively. But by listening to my TED Talk and educating yourself on the signs of PNES and how to deal with it, whether that be through reading my thesis or somebody else's your own internet sleuthing. The most important thing right now is spreading awareness. The more people who know about the disorder, the more people know what to do about the disorder, the less likely misdiagnosis, which I went over in my mini TED Talk, is going to happen. And misdiagnosis, for those of you who weren't there, is very dangerous because if you give anti-seizure medication to a person with PNES who is not experiencing an epileptic seizure, it can make the seizure worse at best and kill them at worst. So it is important that we all know about what this is, how to recognize it, so that people aren't assuming every seizure is epileptic and treating them. Thank you.